The real reason US healthcare is so expensive. Have you ever thought about why healthcare costs in the US seem so unbelievably high compared to other countries? We look into the real reasons behind America's rising healthcare costs in this video. Is it the complicated insurance system, the high cost of running the business, or something else? Come with us as we talk about the main things that are making prices go up and what you need to know to get around the healthcare system easily. Learn about the complicated US healthcare system and how these problems affect you by diving in. Perhaps you've thought about why the US healthcare costs keep going up while other countries keep them low. In this video, we break down the complicated reasons why American healthcare costs so much. What are the main problems, secret costs, and economic forces at play, and how do they affect your money? Come with us as we look into the real reasons behind these crazy prices and think about ways to make healthcare more cheap. Overspending on medical care is a well-known problem in the United States. In 2016, 17.8% of the country's gross domestic product was allocated on healthcare. The average spending of 11 high-income countries, including the United States of America, Canada, Germany, Australia, the United Kingdom, Japan, Sweden, France, the Netherlands, Switzerland, and Denmark, was only 11.5%, according to a new analysis that was published in the Journal of the American Medical Association. The United States spent $9,403 on each individual. That is almost twice as much as what the other people spent. The findings of this study provide a fresh explanation for the excessive spending that occurs in the United States. Price inflation across the board may be what differentiates the United States from other countries, according to the findings of researchers at the Harvard Chan School. They make the point that the cost of medications is higher in the United States. The salaries of physicians are higher. It is more expensive to pay for diagnostic testing and hospital services. In addition, a significant amount of money is allocated to the administrative level for the purpose of planning, regulating, and supervising medical services. With regard to other aspects, contrary to the conventional knowledge, it appears that there is less disparity between the United States of America and other countries than is usually believed. Popular ideas regarding the reasons why healthcare spending is so high are called into question by the analysis. In the past, specialists have hypothesized that high use rates might be the reason for the high spending in the United States. Nevertheless, when the researchers examined the rates of hospital release for a variety of procedures, including knee and hip replacements as well as several types of heart surgeries, they discovered that the utilization of care services in the United States is not significantly different from that of other nations. In point of fact, as compared to the average of all countries, it seems that Americans visit the doctor less frequently and stay in the hospital for a shorter period of time after being hospitalized. It has been proposed by think tanks such as the Brookings Institute that inadequate social spending may also be partially to blame. This is due to the fact that funding programs that aid low-income families, the elderly, and the disabled would reduce the demand for medical care. On the other hand, researchers did not discover a significant difference in the amount of money spent by the United States on social services. However, the United States spends significantly less than the average. When we inquired about the emergency financial plan of 3 different couples, we found that none of them were on the same page. 3 different couples were questioned about their contingency financial plan. An additional point that is frequently put out is that the American healthcare system has an excessively large number of specialists, who typically earn more than ordinary physicians, which results in an increase in expenditures. According to the findings of this survey, however, the ratio of primary care physicians to specialists was comparable between the United States and other high-income countries. According to the author Ashish Jha, who is also the head of the Harvard Global Health Institute and a professor of global health, these data suggest that many of the policy efforts in the United States have not been truly evidence-based, the author stated in a press release. When compared to other nations, the standard of living for primary care physicians, nurses, and specialists in the United States is much higher. According to the data, the average salary of general physicians in the United States was $218,173 in 2016. To put it into perspective, administrative costs accounted for 8% of the total national health expenditures in the United States. The remaining countries have a range of 1% to 3% for their percentages. A higher level of administrative burden was also reported by professionals working in the healthcare industry in the United States. A large number of medical professionals, according to the results of a poll, consider the time they waste due to problems involving insurance claims and the reporting of clinical data to be a serious concern. When it comes to the pharmaceutical industry, the United States spent $1,443 per person on drugs. It was determined that the average amount spent on pharmaceuticals across all 11 countries was $749 per person. At $939, Switzerland came in second place, just behind the United States. A billionaire Google employee discusses his top 3 strategies for accumulating wealth. On top of that, the cost of individual services is higher. According to the data, the average cost of a coronary artery bypass graft surgery in the United States was $75,345 in 2013. On the other hand, the expenses in the Netherlands and Switzerland were $15,742 and $36,509 respectively in 2013. Computerized tomography was also significantly more expensive in the United States, with an average payment of $896 per scan. In comparison to $97 in Canada, $279 in the Netherlands, $432 in Switzerland, and $500 in Australia in 2013. According to the same line of reasoning, the average cost of an MRI in the United States was $1,145, whereas the cost in Australia was $350 and the cost in the Netherlands was $461. There are several areas where it can make sense to increase spending. For example, it is considered that there is a correlation between investing in drugs and innovation. According to the research, the United States of America was responsible for providing 57% of the total global creation of novel chemical entities in the year 2016. In spite of this, they come to the conclusion that whether innovation justifies high levels of spending is not sure. When it comes to compensation, a high salary may be associated with improved performance, and studies have revealed that certain nations do not pay their healthcare workers an adequate amount. Furthermore, it is possible that the high earnings in the United States are a reflection of the time and increased amounts of money that American health professionals are required to put in their education and training. According to the researchers, taking this investment into account does not explain the more than $200,000 difference in compensation observed for physicians between countries, which is a statement that they make. Overall, the researchers are of the opinion that pricing in these regions have to be analyzed and reduced whenever it is feasible to do so. As the United States continues to struggle with high healthcare spending, it is critical that we make progress on curtailing these costs, said Irene Papanikolas, author of the study and a visiting assistant professor in the Department of Health Policy and Management at Harvard Chan School. Although the quality of care is not particularly poor, it is nevertheless not available to all individuals. In this analysis, one of the more noteworthy results is that the quality of healthcare in the United States, at least in certain regions, was comparable to that of other countries. As an illustration, lengthy wait times for treatment are not nearly as big a problem for people in the United States as they are in other countries. It is true that the United States of America had the finest record of any country when it came to treating heart attacks and strokes. Therefore, contrary to the findings of previous studies, it is possible that the quality of care in the United States is not significantly lower than in other countries. The healthcare system of the nation, on the other hand, was found to be the least accessible of all the systems. According to the findings of the survey, an estimated 22% of the population has failed to attend a consultation due to a lack of financial resources. This figure is significantly higher than the average of 11% across all 11 countries. In addition, the rate of coverage among Americans was the lowest. A little less than 10% of the population did not have health insurance in the year 2016. Nearly all of the people in the other nations that were investigated were covered. Since the passage of the Affordable Care Act, there has been a rise in the proportion of the population that is covered by health insurance, according to the report. Despite this, there is a sizable population in the United States that would be better off with health insurance but does not have it. Increasing coverage for these people continues to be a policy priority. According to the findings of the analysis, the cost of labor, drugs, and administrative organization appear to be the primary drivers of spending. Additionally, the report gives new light on how the healthcare system in the United States compares to its counterparts. In addition to this, it highlights the fact that despite the amount of money spent, an excessive number of its residents continue to be uninsured and unprotected. According to the researchers, data such as these are needed to inform policy decisions in light of the fact that patients, physicians, policymakers, and legislators are actively debating the future of the health system in the United States. If you want to understand the complexities behind U.S. healthcare costs and stay informed about potential solutions, subscribe to our channel and hit the notification bell. Get the latest insights and updates delivered straight to you, so you never miss a deep dive into critical issues affecting your life.